I'm really glad to see Women's March trying to tackle these really critical questions. And in terms of thinking about what ableism is, it's an understanding of a structural sort of mechanics of what society does and how it values individuals, and an understanding of who is valued and who is not currently in society. And it's an understanding of individuals who are not as valued, include individuals with any type of disability or chronic illness. I think you have to sort of look at the definition of what disability is and how it's shifted throughout time, to really understand the shifting understanding of what ableism is, and the fact that it weighs heavily on capitalism. It weighs heavily on the understanding of racism, sexism, all of these different structures and how it intersects with each other. In terms of disability justice, I want to give many, many props to a group out on the West Coast that, and I think Becca probably is able to explain it a little more, but there's a group out on the West Coast that really helped establish this term. Alice Wong, Mia Mingus, who created sort of 10 tenets of what disability justice is, and then understanding of valuing an individual based on a variety of different viewpoints and sort of situations that they're in, and really caring about the individual, not based solely on one certain identity, but understanding how all of these identities intersect with each other, affecting each individual differently, and how we need to support these these intersections, and how we need to fight ableism and all of the other isms together, or else we aren't going to gain equality and equity in society.
Rebecca, if you want to follow up. Oh, I think we may have you.
I was muted, I'm sorry.
Oh.
Hi, I'm Rebecca Coakley. I am the director of the Disability Justice Initiative at the Center for American Progress. So the disability justice as a framework was really created by Sense Invalid, which is a coalition of disability activists, advocates, thought leaders, badasses in the Bay Area that included Mia Mingus, Eli Clare, Stacey Park, Patty Byrne, Leroy Moore, and many others. I think it's really critical that it's a justice-based framework and not a rights one. So the end goal is not an achievement of our rights, but an achievement of justice. And it's grounded in leadership of those most impacted. It's grounded in a commitment to cross-movement organizing. The idea that we are whole the way that we are, that we have worth outside of what we produce. A focus on sustainability, and not just sustainability the way that we typically use it in a program sense in terms of like funding, but in terms of like personal and movement sustainability. How do we sustain our movements? What does our pacing look like? How do we support each other in not burning out or burning up? A real strong commitment in interdependence. A lot of times in the disability community, we tend to solely focus on independence, and we know that that's not the reality. And I was really happy to hear you talk about that in the framing. We are all fundamentally interdependent and interdependent on each other, and that was actually an original part of the framing of the disability rights movement by Ed Roberts, who was one of the early leaders of the independent living space, but ended up getting erased over time, which we know is common in movement work. Also the idea of collective access, that we have to move beyond sort of thinking about access from an able-bodied or able-minded normative standpoint, but thinking about like, how do we make sure that everyone has access to what we're working on, and really the idea of collective liberation. When I think of ableism, and Mia did a really solid job of sort of laying out what it is, and the fact that it's really grounded in eugenics and capitalism and racism. I think the thing that always strikes me, and I like to refer to the definition that was created by T.L. Lewis, and specifically the last part of it, which says the form of systemic oppression leads people in society determining who is valuable and worthy based on a person's appearance and or their ability to satisfactorily reproduce, excel, and behave. Like, I love the behave bit, because so often, so much of our society is grounded in making sure that that we're not present, that we're not seen, that we're not loud, that we're not asking for things. And really thinking about like that element, and just like it is with women, the idea that, well-behaved women never make history. The same thing is very true for the disability community. We wouldn't have the ACA if it wasn't for our activists from ADAPT and the Center for Public Democracy and others getting themselves arrested fighting for the preservation of that law. And so I think it's really important, especially from the disability community, where there are laws about our behavior. There are laws that govern what we can do, where we can be, how we're treated in those spaces, in ways that aren't the same for other communities. And being really mindful of that, especially in a time like this, when what we're seeing is, policies being passed by a Congress that don't take into account that we really are the most likely to get sick, the most likely to carry the coronavirus. But yet there's no provisions in place, so we don't have to leave our homes.
Let's go to Imani. How would you talk about ableism and what disability justice is?
So firstly, I generally give people a very quick definition of what ableism is when I do these types of panels or speaking engagements. And I usually say it's institutional and interpersonal discrimination against people with disabilities on the basis of projected productivity of non-disabled people based off of capitalism, eugenics, and all of these things. And disability justice for me is really just about making sure that people at the intersection of disability, no matter what other intersections they have in their lives, are able to be heard and validated, and have their opinions matter to those around them. And this is a very critical moment for people with disabilities and disabled people, depending on where you work. But it feels as though this is a firestorm for us. And we're watching every single stereotype of people with disabilities come together and attack us all at once. The basis of our ability to produce, the basis of our ability to get medicine, care. And it's really disheartening to watch as people close to us, people we've interacted with, adopt these eugenicist points of view, or at least make them louder than they have been. And with this particular moment in history, I do see a lot of parallels back to the straw bans and this environmental conservation that really calls for disabled people to make the sacrifice rather than using the tools that we have as a society to protect one another and to come together and make sure that we all have the resources we need. And so that's kind of, when we talk about disability justice in this moment, it requires thinking outside the box, or at least thinking outside the box that non-disabled people have been thinking within this entire time. Because if we're watching the ways in which non-disabled people are interacting with their employers, interacting with stores and commerce, these are all things that people with disabilities have been doing the entire time. And now we're being pushed out of those services and being put in the back of the line, and our lives are at risk. We are at risk of our daily lives. We're being pushed out of the services we used to subsidize some of the tools that we need, and now life itself is what hangs in the balance for people with disabilities.
I so much follow-up on that. I feel like what you just said just like blew little bits of my mind. But let's go ahead and go to Leslie.
Hey. So, I mean, I don't know if I can even describe ableism any better than the other panelists here. I mean, yeah, ableism really is the devaluation of disabled bodies in our societies, in our cultures, where we see these people as less productive, as nuisances, as burdens, when the real burden is placed on the disabled people to accommodate those around them rather than people like society and our cultures accommodating us. And when we talk about disability justice, especially when we're talking about like things like the coronavirus, it's making sure that our disability activism and our disability focused actions aren't only focusing in on just the disabled identity. It's focusing in on multi-marginalized disabled persons. We're talking about the intersections, making sure that we're not just thinking like disability right off the bat. We're trying to think more critically about how these intersections between race, gender, class, religion, anything like that can impact disabled people and what they face and those further marginalizations in society. Oftentimes we see within the disability community a focus on things impacting middle class disabled people, things impacting white male disabled people, cis disabled people. So it's really important when we're talking about something so that impacts marginalized communities so much, especially we see like lower income communities, majority Black and brown communities being more impacted by this. When we're talking about disabled people within our own community, we have to make sure that we're focusing in on their voices and making sure they're heard.
Yes, so much yes. I feel like this next question that we had, you all have already touched on it, but maybe we can draw out some specifics. So what do you see unfolding at this very moment, and what does it mean for the disability community? So for example, I think it was Imani who said that there's a lot of things that folks who aren't in the disability community are having to grapple with, like changes in life, etc., that the disability community is actually already familiar with. Yeah, I don't, maybe you can speak more about that, but just what do you see in this moment?
So in particular, for those who follow me on Twitter, I was trolled a couple weeks ago for needing grocery delivery to my apartment, or food delivery to my apartment, and people told me that I was harming the working class, that I'm too lazy to go downstairs, so why do I expect somebody to come up to give me my food? And now this is a service that is so overwhelmed that by everybody using it, you can barely get grocery deliveries anymore. And they have started rationing the food that people can get via grocery delivery. So that's a very, very small thing, but there's also prescription delivery. There's, paratransit services that people need to use that are being shut down. There's everyday services. And so, teleworking, Zoom, and things like that. These are all things that we demanded to use to work with employers. We've asked employers to give us the accommodations we need with a lot of fighting and push and pull. And to be honest, a lot of people with disabilities are pushed out of their jobs and out of their schools because they can't get those accommodations. So as a community, to watch non-disabled people take advantage of the accommodations that we fought hard for and still didn't get is very frustrating. And to watch people kind of do things like, even small things like concerts on Instagram Live and, happy hours from their houses. Like, we've been like, well, where has this camaraderie been the entire time that we needed it? And so that's very frustrating. And it becomes life or death when you're somebody with a disability that needs groceries, and because somebody who's non-disabled that may be able to go out of the house is using it, we can't use it. But so we're being pushed out of the services that we used to use to get through our everyday lives that we were told we shouldn't be using because it made us lazy. Which again is another trigger word for capitalism. If we're not honestly working for the food that we put in our mouths, do we really deserve it? And now we're seeing that happen with the coronavirus and the COVID-19. Basically, people have this idea around people with disabilities that if we're not going to be producing after we get well, why should we get well if we catch this disease and this virus? So that was a little bit of a tangent, but those are some of the things that I've started noticing based off of the accommodations that non-disabled people are now getting.
Y'all feel free to chime in. Like, I'm seeing in the chat, everybody's like, go off. So y'all go off.
I think there's actual value too. This is Rebecca, in like stepping back and also defining who we're talking about when we're talking about people with disabilities. Because I think it's very truth-telling that when we look at the actual statute of the ADA, which is the definition that typically people go to, it's not a bulleted list. It's not like white dudes in wheelchairs, blind folks, deaf folks, people with intellectual and developmental disabilities. It's a mental or physical impairment that impacts one or more activities of daily life for a person, a history of such impairment, or somebody's relationship to somebody with such an impairment. And so the community itself is huge. If you want, like, for example, one of the largest disabilities in this country are eating disorders. And we don't talk about that frequently as part of the disability community. For women in particular, so many quote unquote women's diseases and disorders, which were chalked up to hysteria for centuries, whether it be migraines, fibromyalgia, chronic fatigue, things of that nature, are part of the disability community. Things where you might be able to run a marathon on a Saturday and then Monday you can't get out of bed. And that's real for a lot of folks. And I think specifically for folks who live at the intersection of disability and other marginalizations, those are the folks that are most significantly impacted when you have a disability or a chronic illness, or I think that this administration has now called us underlying conditions, which is like the new one. We didn't ask for that, thank you. But those are the ones that are often caught up in these situations where people are like, well, you don't look that disabled, like get up and go to the store. Or why do you need X? And so I think it's really important, like to have an understanding of the fact that like this is a big tent here. And this is a tent. Oh, shout out to Molly Doris Pierce, who just texted me that she's on the chat. Hey Molly, we love you. Like at some point in time, and I hate this talking point, but it really is true. Like almost anyone can become part of the disability community. And the reality is knowing the history of our community, if you look back at polio, if you look back at people impacted by, even last summer, PG&E's inaction in California that impacted so many folks with disabilities, these sorts of times actually create people with disabilities. This is where our numbers grow. And so having an understanding that we don't know what the long-term impact of the coronavirus is going to be, meaning are we going to have people who are going to end up with some long-term significant respiratory impairment that is going to require the use of reasonable accommodations? That's damn likely. And because of that, and people who are obviously coming out of this experiencing trauma, either their own personal trauma or trauma associated with their jobs, frontline healthcare workers are going to be joining our community in droves. And so thinking about the fact that like, we don't even have a handle at this point on how big the impact of the coronavirus is going to be on the totality of the disability community.
And I wanted to add to Rebecca's statement about people with intersecting identities who are part of the disability community. We also really need to include undiagnosed people as a part of the disability community as well, simply because health disparities among minorities, LGBTQ community, women especially, it means that they don't get a diagnosis because they're not taken seriously about what their experiences are, what their bodies are doing. And we're seeing this play out as well with the coronavirus and COVID-19. We're seeing a lot of stories of Black women who call to get tested, who call to go to the doctor, who are now winding up on ventilators because their doctor didn't believe them. And so this is something that is going to be playing out throughout the entirety of COVID-19 and COVID-19 treatments. There will be disparities on who dies based on their other intersecting identities as well. And so when we talk about disability, we must also talk about the undiagnosed who've been fighting for a diagnosis and to be taken seriously by medical professionals.
I would just add one thing on to what Imani said, because I'm like there 100%. When you look at particularly now the impact on people's availability of medications, we know that the president is talking out his ass. And yes, I said talking out his ass. I don't know if we have to caption it when he does that. That's actually a secondary question I have around the ADA. But the point I want to make is that women of color, or 25% of people living with lupus, are Black women. And we know that when the president got on television and started talking about drugs he hypothetically had heard from somewhere, probably on Fox News, had a positive impact on people with coronavirus. It actually ran up the costs and ran down the availability of the most popular, most commonly used lupus medication. And so this is having a disproportionate impact on Black women with lupus who can now not get access to their medication, are actually being told by pharmacists that they're selfish, asking for refills, are getting pushed towards less effective drugs or drugs they may have an allergic reaction to because of rhetoric. And I mean, that shows the exact connection between, lies being perpetuated by this administration impacting the actual literal lives of Black women with disabilities in this country right now.
And it's
You want to go?
Oh, so sorry. I just had one little point to what Rebecca was saying. The manufacturer of that drug actually thanked people for their sacrifice, for giving up the drug. And yeah, they tweeted out a statement saying, "Thank you for your sacrifice." But I want to make a point that sacrifice requires consent. And none of the people that are having their drugs taken away from are consenting to this, regardless of the availability, regardless of what the president says. Nobody's making these sacrifices, including anybody in the disability community, for the economy or for the to be the backbone of Trump's lies.
Yeah, definitely. What I wanted to also put in place or talk about is sort of some of the unintended sort of consequences of what happens during sort of emergency situations and during situations as what we're in right now. And one of the things that is being talked a little bit about in Asian American communities and immigrant communities is the fact that there's a significant rise in hate crimes against Asian Americans, specifically East Asian Americans. And the biggest thing that I worry about, because they're saying that right now it's at, I believe there's been reported 100 cases of hate crime a day against East Asians right now, which is sort of being underreported in the news right now.
Oh my God.
And just recently in Texas, there was a family that was stabbed. It was a family with a 2-year-old kid. And the thing about it is that in Asian American communities, we have a tendency to ignore mental health issues. Partially that's because of just culturally how we deal with things, but another reason is because of the lack of cultural awareness within the medical field, especially within mental health fields. But we're dealing with a real crisis of individuals who are dealing with significant mental health issues because of the rise in hate crimes and the lack of services, culturally competent services. And so my worry is, and then this is something that I've been trying to figure out how to write about, is that we may be seeing something that people won't pay attention to until after this is done, which is a pandemic of mental health issues, a pandemic where it's going to result in mass casualties of people who are not getting the treatment that they need in a time of crisis, and which could result in mental health crises and unfortunately deaths via suicide. And so, you know, I think it's something that I want to keep very, very on people's forefront, is like, you know, and I think this is part of one question that you have later going on, is making sure that you check in with folks, making sure that you're checking with them in with them often, because there are individuals, especially in Asian American and people of color communities, that we're dealing with a high percentage of individuals dealing with mental health issues, and it's not being talked about. So I just wanted to keep that in people's forefront as we're dealing with this situation.
And I just wanted to bring up a couple things about what's going on in response to businesses and schools going onto Zoom and creating kind of an accessible curriculum for the first time, when so many of us have fought to even be taken seriously for our disabilities. And I look back to even my own college, and how I would get penalized for not showing up to class, and would talk to my teacher about alternatives, and we say there's no other option, it's impossible, it can't be done. And this is the same teacher who this semester sent out an email to his students saying, don't come to class if you're sick. And one of my biggest issues is that I struggle with epilepsy. I can't physically be safe in class if I'm having seizures. That's not okay to force someone into. And we see at least at my college, what we saw was that people, individuals of colors, especially Black students with disabilities, were taken a lot less seriously than white students. Their accommodations were taken more seriously. And white students accommodate. I'm gonna mute myself.
Give Leslie a second. Did you burn the brownies, Leslie? Cookies?
I think in terms of what Leslie was talking about, I think one thing that I have been talking with individuals, especially in progressive movements, is the fact that we really need to be watching out for a restriction of our civil rights as the government continues to ratchet up its response. We saw in version 3, and I don't know, did it end up in version 4? That the waiver on IDEA.
So it was in version 2 and 3. In 3, the blanket waiver got removed. So Senator Alexander wanted to propose a blanket waiver on IDEA broadly. What ended up being included was that the Senate is going to ask Betsy DeVos, that woman, for a report in, I think, 180 days, I think is the number. I forget off the top of my head right now, as to what pieces of education policy she, as the brilliant secretary, would suggest be waived. And we know without a doubt that it's going to be IDEA. Oh, 30 days. Thank you. It's 30 days.
Yeah, and so I think the biggest concern, I mean, as an individual who is East Asian, having seen what happened in World War II, where Japanese Americans were interned, when we see immigrants who have been interned in concentration camps down at the border and across the United States, times of crisis are often times that individuals who aren't so happy with the movement of the country use that time to cause restrictions and actually roll back the civil rights that we have fought so hard to get past. And so I think I know it's so easy to, or it's not just easy, sometimes it's necessary to try to pull back from what's going on in the news and what's you're seeing happen across the country. But I ask that you spend some time keeping track of what's going on in Congress, so that we can make sure that when folks say that it is a red alert and that we need to fight back against some of these rollbacks of civil rights, particularly when you're talking about women and you look at the abortion clinics that are trying to close, the states are trying to close in Ohio and Texas. These are things that we need to keep an eye on, because we didn't do a great job after 9/11 keeping an eye out on that. And so my request is just to make sure that you pay attention, because right now we're already seeing that through suggestions of waiving the IDEA and other provisions, including providing sort of affirmative action for small businesses to receive grants and such in the government. I've seen it happen again and again, and unfortunately, we have been scrambling so much that we haven't had as much pushback as we need from the entire community trying to fight back against some of what's going on right now.
I also think it's important to point out that the U.S. Chamber of Commerce, in their recommendations for coronavirus legislation, asked for a waiver for the ADA for employers to be able to ask current and prospective employees anything they wanted about their health history and their medical background in order to be proactive around the coronavirus. Where the ADA has very strict rules about what can and cannot be asked as it relates to someone's health background or disability or record of disability. And I want to take a moment and give props to two of my favorite legislators, Representative Katie Porter, the queen of the whiteboard, and Representative Rosa DeLauro, with the most fabulous accessories on the face of the planet, both of whom co-authored a scathing letter to the U.S. Chamber that we tweeted out repeatedly that said, in no uncertain terms, in times like this, are we going to be talking about waiving civil rights protections? I actually want to bring up something that was actually shared in the chat. Is that cool? Because I think it's really important.
Oh yeah, go for it.
Anastasia Somoza, I see you out there. Hey, friend. Anastasia brought up the fact that there is resistance from Congress around including funding and resources for home and community-based services in Package 4. We are already actively working on what Package 4 needs to look like. I actually took calls last night from a couple of Hill offices at 11:30 last night who are actually starting to put pen to paper on this. This is critically important. I want to encourage everyone to be monitoring the hashtag #WeAreEssential. There's a growing coalition of national disability organizations and badasses all around, including Imani and others that we're working with right now that are going to be making a significant month-long push starting next week around what our advocacy needs to look like. And I would very strongly encourage folks that we need to be speaking with one voice. That's really hard for the disability community. There's 61 million of us. We need to be speaking consistently, and we need to, this is not like the ACA fight. And I want to be very clear, like during the ACA fight, we were able to show up at the Capitol and yell at members. We were able to go to offices. We don't have that now. We can't even call offices because office staff are working from home. And I just learned this last week that House staff don't have laptops and they have to actually write legislation on their phones. Holy shit.
What?
That's a problem. Yeah, I had no idea. Like Hill staff told me that this week and it totally blew my mind. Way, not just no way, way. It's bananas. But that being said, we are encouraging folks to post videos using the hashtag #WeAreEssential, tagging your legislators. We'll have themed weeks coming up that we're going to release information on at the beginning of next week. But there is a strategy. We're working on it, and we need everyone. If you've never reached out to your member before, now is the time to do it. We have scripts for you. We have tools. You can use ResistBot. There's all kinds of resources that you can use to actually reach out to your members. But now more than anything, they're attacking us on all fronts. we need every person's voice. We need family members' voices. We need special ed teachers' voices. We need your second cousin twice removed wedding dress designer's voice. I don't even care who it is. Like if your dog has an Instagram account, I want your dog like tagging Chuck Schumer and saying, Chuck Schumer, you need to care about my mom. Like, get on it, Chuck. We see you, Chuck. From Chuckles the Pomeranian. So like I really want to make a point that like this needs to be a big thing. And obviously the rationing piece is a huge piece of this, which we should probably also talk about. But I really wanted to hit that like there is action happening right now. And we need to make sure that we get language out to folks.
And I just want to say fundamentally, when we talk about civil rights being rolled back and we talk about them forgetting us on pieces of legislation, we need to fundamentally understand that people who are against civil rights, this is their best opportunity and they are seizing it. And so in order for us we need to be in their faces in the only way we know how. And to be honest, the disability community is well equipped to raise some hell online. But we need you to be a part of it. We really need you to participate and call out your senators. The best way to kind of participate in the hashtag and call out your senator is to tag them and use the hashtag at the same time in the same post. And if we all do it at the exact same time, it will overwhelm the system and we'll start trending and things like that. So we'll bring it down. We'll crash the system. We'll make some noise, and we really need to get as many voices on this as humanly possible, because this is extremely important. And they, like I said, they see this as their opportunity to do everything they've ever wanted at once.
This conversation just has like so much in it that like you could just write dissertations on all of this. It's legit. I'm gonna, if our panelists see any particular questions popping up in the Q&A that you want to address, please go for it. There is one that's maybe a little existential, but I think it matters, and it was mentioned a couple times, which is, do you feel that this particular moment where, folks who don't identify as part of the disability community are now seeing all of these things that the community has already seen, do you feel like this is something that's going to lead to a change for how the disability community is going to be treated? Why or why not? Go off.
I mean, if I like from where I stand and see it, this could be really positive or it could be negative if it gets co-opted. If we're talking about this and we want more people on it, we need to ensure that we're making sure the people who have been doing this as long as the disabled people are at the table and helping to make these decisions and helping to organize, not organizing for us, but organizing with us. I think a lot of the times that when we see outside communities come into a marginalized community's issues, we see some people say that they know better than these marginalized communities. The best thing to do is to make sure if you're putting something out there, check with disabled people, check with this, like go on Twitter, see what Rebecca's saying, see what Matt Cortland's saying. There's so many of us putting this information out.
The only man we trust to talk about anything.
Honestly,
I just had to say that.
Love that man more than anything. But yeah, see what we're saying and repeat it. Talk to us, discuss with us. Don't go out of your way to try to tell us you know better. I think that's a lot of the issues we see when we gain a bigger momentum around our community on these issues, but they lose sight of it being really a disability issue.
Anybody else?
Sure. I don't necessarily see people changing without us at their backs, if that makes any sense. I think that the American memory is short. And I mean, even just Western memory is very short. So when we talk about people making a lasting change, making some big commitment to the disability community, I don't see that happening, because even in the situation that a lot of them are in now, they don't correlate it to the disability community and our lived experience. Because quite honestly, a lot of people still have that very paternalistic nature in saying that that's them, this is us, I don't need anybody to tell me what to do, this is, I'm living my life, I'm not a part of the disability community, I'm never going to see myself as a part of the disability community. And I don't really think that people will change unless we force them to change, unless we make a bigger noise, because disability rights are human rights, and no matter what stage of quote unquote non-disabledness you're on right now, that could change at any moment, like Rebecca says. And so we have to kind of put a bug in their ear and say to them, this could very easily be your circumstance. This could very easily be the resources that you need one day. So invest in them now. If we use a capitalistic metaphor, I think we need to tell them that they need to invest in their disability rights now before they need them, and kind of get them to engage with us in that way. But otherwise, I don't quite see non-disabled people investing themselves in disability rights unless they are personally leveraged with them.
Yeah, and I mean, as somebody who doesn't identify as part of the disability community, like, I mean, I'm listening to you all and I'm having all of these like questions come into my head, like, wait, why didn't this lefty group that I'm a part of why didn't they include the disability community more? Why didn't this other group include the disability community more? And especially as somebody who considers themselves a fairly anti-capitalist, like, I loved that like framework that you all mentioned about like the correlation between productivity and the way in which folks in the disability community are made invisible because they, quote unquote, don't produce. So yeah, it's my own wheels are turning about like, wait, how can we turn rhetoric into action? Because a lot of people talk, a lot of people talk about including the community, but you don't always see the action.
Yeah, I just mean, like, even building off of that, we see a lot of like a huge push for things like paid sick leave, making accommodations so people don't have to go into work and risk their health, and things like that. And those are things that forever the disability community has pushed for. These are things to make it so that our caregivers, our families, our individual person is able to fully participate in society without barriers. It's about breaking down those barriers, those societal barriers. And so yeah, I'm so happy that I see people that are currently, that I wouldn't typically see talk about these issues. But like what Imani said, like when this is over, when this is not impacting them anymore, are they still going to be there? And are they really going to be dedicated to this issue? We really need to make sure that even though COVID-19 will pass, like this pandemic will eventually pass, these issues are still impacting these communities, especially the multi-marginalized within just the disability community.
I'm reminded of Susan Daniels, who was a longtime badass in the disability community. She was one of the senior officials at the Social Security Administration back in the day, when I first moved to DC. And one of the things that Susan would talk about, and she was from New Orleans and had a lot of friends and loved ones from New Orleans. And so she would talk about, people would ask her post Katrina, they would be like I remember when Superstorm Sandy was coming and they were like, Susan, what's going to happen to disabled people in New York and New Jersey now? And she was like, I have hope, but I also have the burden of history. And when I think back time and time again, whether it be to last summer and the tremendous activism of the Disability Justice Culture Club out in the Bay Area, Stacey Park and folks pulling together to do what the state wouldn't when they were cutting off power to help support people that were dependent on ventilators and respirators and other technology that they needed to survive. And the state's like, oops, my bad, figure it out, bye. Going back to Superstorm Sandy and thinking to the brilliant story on NPR around our colleague and dear friend Alejandra Ospina and her loved ones up in New York and what they were having to do to get the care that they needed at that point in time. I mean, looking back to Puerto Rico, I mean, we still haven't taken care of Puerto Rico for fuck's sake. And all the disabled people in Puerto Rico, all the people impacted by Puerto Rico. I mean, that you talking about like short memories, it just hit me. I was like, wait, we still haven't fixed what happened in Puerto Rico. And so, like, I'd like to believe that I can trust in my non-disabled brethren to give a shit, but y'all's track record really isn't that great.
Nope, pretty terrible.
Downright irritating in some ways.
So we have approached the hour, but I don't want to stop. We did have a final question, which I feel like you all have also already pretty much touched on. What sort of actions can we take? What can we do in this moment to fight for disability justice on a local level, on a state, national, or a communal level? And I've heard some mention of what can be done. I've heard hashtags, etc. I want to encourage panelists and really anybody else. I've seen some folks do it already. Share links in the chat. The chat will disappear once this webinar is done, so grab those links while you can. But we're also going to compile some resources based off of what our panelists will provide us in a follow-up email, including a recorded version of this webinar. But yeah, I don't know if you all have any sort of final, like, how can we take action? What can we do? If you want to remind us about some of the things that you mentioned earlier. I wish we could talk so much more, especially I saw a lot of questions about like, what are Spanish resources? Questions just in general about race in the disability community. Yeah, just anywhere we can go from here.
There is, they have this entire thread. I could share it on the Women's March Disability Caucus Facebook page for LGBTQ plus resources for the coronavirus. And a lot of them are organizations that also focus in on disability and have a good track record with disability. I could post that on the Women's March page, but when we're talking about also what individuals can do, there's like two major things I think right now that individuals can do to really help the disability community. And these aren't like, this is even completely separate from talking to your representatives, anything like that. These are individual actions. Like we said earlier, checking in on your friends, your peers, especially disabled people. They may be struggling with fear right now or trauma. We're often forgotten about during these crises. And so it can feel kind of demeaning when you see, I mean, I see it all over Twitter, people saying like, oh, battlefield triage, we're going to focus on the healthy and the youngest and give them health care. Like us constantly trying to remind people like that's against the law. We have the government has even put out information on how we cannot discriminate right now. But people kind of justifying eugenics, like it can be really hard on people's mental health right now, especially from the disability community. Feeling like our lives are expendable and that people don't care right now is a huge, huge issue. Another thing that I think is something that you can do on the individual level is make sure you're not hoarding resources. Things like alcohol prep pads. I've had to help people find alcohol prep pads around the country so that they can take their injectables. People are buying them because they have the alcohol in it, so they think they can clean things, but they don't realize people need that to take their medications, like to use their injectables. And things like not using, like if you don't need a certain, like gluten-free pasta or something like that. I have a sister who has celiac, and we're having issues finding food that she can eat right now because people are stocking up who don't need these resources and taking them from people who actually do need them. I think like even like we were talking about toilet paper or how people were stocking up on that, and we had lower income people not being able to find toilet paper when it came time to because they can't stock up. They have to live, a lot of them live paycheck to paycheck. So so they don't have that ability to stock up. And low income and disability are so connected. The cyclic poverty that exists within our community, it's important to understand that things like that are big issues that are impacting a large part of our community right now. Just not hoarding, not stockpiling, and reaching out to those around you is really the biggest things I personally think that you could do just as an individual, your own actions, things that you can control.
Anybody else? We're gonna use this as a sort of final thoughts from our panelists. Where do we go from here?
It's Kendrick.
Baby.
You want to say hi?
Hi.
Say hi.
I think some things that people can do are, support the voices of people with disabilities online, because that is the form in which we're going to be operating a lot for a while. I kind of feel, I don't want to let anybody down, but I think that projections that April 30th is when we will get back to normal are short-sighted. So please keep that in mind when you're using platforms and things like that. This will be in for the long haul. So pay attention to what people with disabilities are saying, what disabled folk want you to hear. Utilize apps and things like that, like Nextdoor, to check on your neighbors to see if anybody needs help getting groceries. Try not to overwhelm the system, because a lot of the services that people with disabilities use just to supplement some of their needs are being overwhelmed. So we can't get a lot of the things that we need, like groceries and medications and things like that. Contact your legislators as well. And people were talking about medical rationing, and they're afraid, like, who do you contact if that happens? There's a network of legal aid workers for people with disabilities called the Protection and Advocacy Network, that are working on this very diligently to make sure that these policies are never put into place and that everybody gets the care that they need. Governor Wolf did sign, at least for Pennsylvania, Governor Wolf did share a press release saying that nobody will, quote unquote, be put to the back of the line. HHS put out a guidance saying that nobody would be put back in the back of the line. But the question is, a lot of times you don't know about these things until these rights are violated. So that's the frightening part, is that I have people tagging me in stories about them telling their spouse, don't tell the doctor what my diagnosis is because I'm afraid he won't treat me. And so even if these policies are not technically being put into place, it doesn't assuage any of the fear that people are having, or any of the or change any of the plans people are making to interact with medical professionals right now. And so it's critical that you, in addition to supporting healthcare workers, in addition to trying to get them the resources that they need, we really need to have medical professionals as well take a look at their inherent biases, because writing a letter doesn't change a doctor's mindset when they look at you, when you first come in. And these legal recourses are helpful, but we really need for the medical community to kind of pay attention to them. But they're in the thick of it right now, which is the frightening part. So yeah, I think that support PNAs, support protection advocacy agencies, and make sure every state has one. So find your local PNA and make sure that you know where your legal recourse is. And they are taking intake calls to make sure that if you have any issues during this time, that you have legal recourse, or at least an advocate that may be able to help.
That's great.
Yeah, Imani, that is great. So I think a couple of things that folks have talked about and the things that I've talked about, I think of a couple of things that folks should keep in mind. One is what Professor Moody says is constant vigilance. So I know Becca also enjoys that quote, so she has it on her tattoo. But anyway, understanding that these are times when folks like to utilize to suppress people's civil rights. So be constantly vigilant and make sure that When folks from marginalized communities are asking for help, especially pushing back, that you step in as much as possible and help uplift those voices, not talk over, but uplift them. Another thing is understanding that policies that legislators up and down the board create are often more complicated than you can ever think. That there are ins and outs that you might not think about, and specifically when we talk about UBI, the Universal Basic Income, and how that is much more complicated than folks think of when you're looking at SSI, SSDI, and other means tested services, to understand that you need to check in with marginalized communities, including the disability community and communities of color, to understand that while progressive policies may seem to be good on the front end, they might have unintended consequences. And I've seen that time and time again, specifically affect the disability community in multiple ways. So making sure that you, when you're looking at progressive policies and trying to get them enacted, that you talk to marginalized communities, including the disability community, when you're advocating for them. And when a community says that they can be harmful to the community, that you listen to them and not talk over them. Also understanding that disabilities can be invisible and that you may never know what's going on in an individual's life, and that individuals may actually need N95 masks to be able to go out into the community. And we have seen people do some backlash against people with chronic illnesses and people who are have vulnerable immune systems be attacked because they are wearing these masks. So to be very careful when you are addressing these issues, and understanding that you may not realize that an individual may have cancer or some other type of issue that's going on, and to be kind to individuals. And lastly would be just to, again, what Imani and all of us have been saying, is check in with people. You may not know what's going on in their lives, whether they're dealing with mental health issues, or if they are also dealing with domestic violence issues. This is a very, very sensitive time. We have seen a significant increase in domestic violence calls into 911 and other organizations, and to understand that we need to support our communities. And we are lacking a lot of the supports that we had in place, and those supports were already inadequate. And now that we are all secluded in these different areas, that it's really important that we that we develop supports within our communities, because unfortunately right now our legislature and our administration is not going to do it for us. So we need to take it within our own hands and build community supports.
The last thing I would say is, I think it's really important that when we see disability is missing, or when we see disability is not at the table. There's a Twitter, I don't want to call him an influencer. There's a dude on Twitter who put up a list last night of the 20 biggest priorities around package 4 and the disability and what needs to be in package 4. And this is someone that has disabled people on his board. This is somebody, or had disabled people on their board. We ended up all walking off. But put disability at 19 of 20. And a bunch of us were like, really? Like, second to last, dude? Come on now. I actually want to commend the Women's March for doing this call, for doing this webinar. And I think we need to see and hold more of our progressive partners, both individuals and organizations, accountable for ensuring that disability is part of their priorities. I want to give props to Time's Up, who released their priorities today. And the disability community, several of the disability communities, like top priorities, were included in that. I know the Working Families Party is looking at engaging with the disability community in the next couple of weeks as well. You know, we've done a lot of work over the years with Moms Rising and other progressive organizations. If you're part of a progressive network or a progressive organization and they're not centering disability and what they're doing on coronavirus, y'all are doing it wrong. And reach out to us. We won't shame you. Okay, we might shame you a little bit, but it's not going to be like Game of Thrones walking with the bell being like shame, shame, shame. We might do that behind your back, but like we can have that conversation. We are willing to sit there and be the test subject in a room. I mean, we have to do it on a daily basis in our lives anyways. We might as well do it for the good of the movement. Like, how can we be helpful in helping progressive organizations, progressive leaders, like networks, etc., like be more inclusive of people with disabilities? The last piece I would say, and I saw it come up a couple of times in the chat, is we need to have a real conversation about what's happening in nursing homes and institutions right now. Right, I believe as of the 23rd of March, there were 127 nursing homes across the country with mass outbreaks in 27 states. And we know this started, like it blew up in Washington State because of the nursing home industry. One of the things that Ron Klain said on MSNBC a few weeks ago was countries that do not put disabled people and aging people in nursing homes are seeing a different type of spread than we're seeing here in the States. And so we really this is a juncture for us to have the conversation about deinstitutionalization and the need to move past our institutionalization bias, to talk about actual home and community-based services for all people. Because had we been doing it all along, we wouldn't be in this position right now.
I would say that non-disabled people, if you are caught unawares by what's going on in the world around you, I want you to take an internal inventory of the way you view disability and the way you talk. Because a lot of times the way we speak to one another reveals the way we feel about different races, ethnicities, people of different sexual orientations. And so a lot of times, a lot of people don't notice that they're using ableist language every single day in every single conversation that they have, and then are caught by surprise when the world around them is ableist and is using that ableism against them. So when you say that you have quote unquote a blind spot, or you call things stupid or crazy, those are all diagnoses that are used for people, or that have been used historically for people with disabilities, are used currently to other people with disabilities. So pay attention to your language. Pay attention to the ways in which you use stereotypes and different words in your lexicon to other people using disabilities. And then start thinking about the ways in which we talk about our leaders. You know, a lot of people think that Donald Trump has a hidden disability, which is why he acts like this. Racism is not a disability. You know, make sure you understand the way you view disability through the way you speak yourself, and then kind of deconstruct the world around you and say, this has always been here. And if I don't work on it, it won't go away.
That was great. Like, I know I'm probably not supposed to pick my favorite webinar, but I'm gonna pick my favorite webinar, and thus far it is this one. Thank you all so much for joining us. We went over, but I think that's a good thing. I'll just reiterate to everybody that this was recorded. We will have it up on YouTube as soon as possible. Hopefully I can get around to doing it by the end of tomorrow, and we will be sending a follow-up email as well. Everybody registered for the Zoom, so we have your emails. And again, we'll be collecting a list of resources. We'll make sure to have the names of all of our panelists available there. And I believe we may even have some illustrations to help. We've had I forget what they're called. They're like the folks who scribble like the things that you're saying. I don't know. She's been great. So we'll probably have that as well. And yeah, thank you all so much. This was great. Thank you so much to everybody who attended. So many of you, so active. I love it. And I hope everybody has a good night.
Good night, everyone.
Bye.
Thank you. Good night.
Everyone.